Next topic is all about preceptor roles and responsibilities. What is a preceptor? A preceptor is an experienced practitioner who provides supervision during clinical practice. A preceptor is an instructor, a tutor, or a teacher. What is the objectives or the purpose of this lesson? By the completion of this workshop, the participant will be able to determine the essential facts related to the concepts of preceptorship, including critical thinking approach. Learning outcomes. By the completion of this workshop, the participant will be able to list at least 6 characteristics of an effective learning environment. Identify the main characteristics of an effective preceptor, and to identify the main requirements needed to be a preceptor. What are the teaching methodologies? It could be a classroom lecture or discussion, a group discussion, a scenarios or a case presentations, a small group activities, role playing, demonstration, or one-to-one coaching and training in clinical areas. What are the teaching or learning materials needed? Whiteboard and whiteboard markers, flip chart papers, LCD projector, associated handouts like manuals, worksheets, competencies, and etc. What are the evaluation methods? Number one is the immediate feedback. Immediate feedback technique allows the participants to receive immediate feedback to assess their knowledge. Progress tests, pre- and post tests. This is a written knowledge exam, usually multiple choice questions, to assess participants' knowledge and to measure their progress by how much they gain or to determine the growth of each participant. Clinical practice competency. This is an examination that assesses knowledge and practice or skills of each participant. Reaction forms. Reaction form is to measure the participants' opinions about the content, quality, and usefulness of the training. 6 to 12 follow-up. As the name suggests, biannual evaluations are held twice per year. This is to evaluate areas of improvement and goals for the next 6 months. What are the roles of clinical teachers or a preceptor? One-on-one supervisor. Focus on the participants and clearly specify desired outcomes. Used to keep in the loop and help participants grow in their roles. A preceptor can be a role model. The preceptor leads by example. He or she should help participants integrate clinical and professional practice. The preceptor demonstrates exemplary ethical behavior and enthusiasm for practice and interacts appropriately with other members of the healthcare team. A preceptor could be a facilitator. He challenged the participants to continue to grow. He can be a friend and counselor. The preceptor understands and supports social needs, resolves conflicts issues if they arise. He can work as a team builder, understands and supports social needs. A preceptor is an evaluator. Evaluator ensures adherence to standard of practice, validate the competent practice of participants, recognize limitations, and identify delegations or accurately concerns. Please review and answer the exercise number 2, 3, and 4. Preceptor roles and responsibilities. Patient care, nursing process, Nursing process is a systematic problem-solving approach for giving comprehensive patient care or nursing care. Nursing process has 5 steps. Number 1 is assessment, diagnosis, planning, implementation, and evaluation. Another responsibility of a preceptor, he could be a mentor or educator. This is to provide daily guidance to participants and to support them in the development of their skills. Consultation, orientee evaluation. Continuously assessing the orientee's current knowledge by observing him or her and providing ongoing feedbacks. Another responsibility is social integration. Social integration is the need of the participants to interact with his colleagues in the workplace. This is to maintain peaceful social relations for social support and friendship. Another responsibilities of a preceptor is to provide orientee with a preceptor alternate when necessary. Provides preceptor alternate with adequate information regarding orientee's abilities. Attends nursing preceptor workshop. Assumes responsibility for own professional development as a preceptor. Attends a minimum of 2 hours of related educational activities per year. Continuum of learning. Prior learning and experiences are also known as life experiences. Next is the orientation phase, the process of introducing an individual to a new workplace. And then in service, this is important to face new challenges and continuing education. Those seminars, workshops, online courses, research, or community service to help you improve job performance. The first is the preceptor selection and preparation, and then district orientation, nursing induction, work unit orientation, and preceptorship. Thank you.